Good evening. My name is Victoria Jeffries, and I am the facilitator for the meeting this evening. Brett will be your presenter, and we will have 45 minutes for him to share information and for you to ask questions. Even though your camera and your microphones are off this evening, you will have the Q&A feature that will be the way that you're able to communicate any questions that you have. So throughout your time together, please don't hesitate to type in anything that you want to know. At the very end, there will be a quick slide I want to show to give some housekeeping items before I end everything. I do want you to know that all the sessions, today's included, from the virtual college exploration have been recorded, and they are accessible at oacac.org. And so now I will turn the screen over to Brett and let you learn more about his programs and his university. Thank you.
So thank you so much. My name is Brett Hartnagel. I am the Director of Admissions at the University of Minnesota Rochester. I am originally from this great state of Ohio. I am a former Buckeye and attended Orange High School in Pepper Pike, Ohio. So for those from the Cleveland area, I say hello to all of you. And so what I'm going to do today is just do a brief overview and brief presentation on the University of Minnesota Rochester and all the different programs that we can offer. So a quick little history about UMR. We are part of the University of Minnesota system. This system consists of 5 campuses, Twin Cities, which most people, when they think of the University of Minnesota, they are referring or they're thinking about the Twin Cities. The Gophers, which are part of the Big Ten Conference, they're located in both Minneapolis and St. Paul. We also have 4 other campuses, Duluth, which is our medium-sized campus up in the northeast part of the state by Lake Superior. We have Morris, which is our liberal arts campus, which is west of the cities. Crookston, which is in the northwest part of the state and mainly focused on agriculture. And then we have Rochester, which is in southeast Minnesota. And UMR was founded because Rochester is now the 3rd largest city in the state of Minnesota. We are the 3rd largest behind Minneapolis and St. Paul. We have a little over now what they estimate is going to be 150,000 people by the 2020 census. And we are growing mainly because of the draw to Rochester. We are known as Med City. And we are known as Med City because we focus on one program or one career, and that is healthcare. The Mayo Clinic, which is the world famous #1 ranked hospital system in the United States, is located. Their headquarters is located in Rochester, Minnesota. 2 to 3 million visitors come to see the Mayo Clinic each year as patients. And so with that, Rochester has boomed, and the University of Minnesota wanted to offer a specialized campus that focuses solely on educating and training the next generation of healthcare providers. There is an older generation of healthcare providers that will soon retire, and the path coming into the programs are not coming in quickly enough. Mayo Clinic, along with a lot of other hospital systems around the country, are concerned that the need is going to exceed the workforce. And so, especially as we can see now during this pandemic, there is certainly a need for more healthcare providers. So with that, in 2009, University of Minnesota Rochester officially opened its doors. So for many of you watching tonight or later on, you are older than the University of Minnesota Rochester. We have now graduated 8 classes, and we continue to grow our enrollment each and every year. This enrollment number of 723 has now gone up to close to 900 students. And so we are continuing to grow each and every year, but we will never be a 5,000, a 10,000, or a 50,000 sized university. That is not our goal. That is not our mission. Our mission is to stay a smaller university. And the reason why is because to learn chemistry, to learn biology, to learn anatomy, and to learn these healthcare careers, it is better to do it in a smaller setting, in a setting where you really get to know your faculty, you really get to know your advisors, and you really have, you're not feeling like you're just a number. So we really value our small class sizes. We value the fact that 96% of all courses taught at the University of Minnesota Rochester are taught by full-time faculty. So you are being taught by the best, by the experts in their field. We're also proud about the fact that our advisor to student ratio is about 80-1. And if you think about it, the national benchmark for institutions is about 200 to 300 to 1. Think about your high school. If you go to a large public high school, you may have a few hundred students per counselor. Here, it's just 80-1, which means our counselors, or what we call student success coaches, really get to know you, and they get to know what your dreams are, what your career goals are, and what's the best path to get there. Because while many of you may be thinking pre-med, maybe thinking nursing, maybe thinking another patient care career, they're not all exactly the same. And so we want to make sure that we're getting students to their correct path, their right path that pursues their passion to help others. Another big factor about our university is our student body. We're one of the most diverse student bodies in the University of Minnesota system. 80% of our students come from the state of Minnesota, 20% come from the upper Midwest and around the rest of the United States. So we do see some students from Ohio, Michigan, Illinois, Wisconsin, and both Dakotas, as well as Iowa. We are primarily a female-dominated campus, though we do have about 85% of our students are female, 15% are male. We are trying to encourage more males to go into the healthcare profession, especially areas like nursing and PA. We're about 42% students of color. We are 40% first generation, and we're 39% Pell eligible. So we are trying to do our best to support students coming from low economic backgrounds. For majors, you're not going to see a list of majors. And the reason why is because we really have one primary major. When we started back in 2009, we made a conscious decision not only to be small, but not to have chemistry and biology and physics and biochemistry as a major. If you're interested in going into medical school, it really does not matter if you're looking to do a biology major or a chemistry major to get to medical school. Medical schools, along with a lot of other graduate and professional schools, only require that you have a bachelor's degree, that you have the right prerequisite courses, and that you have the entrance exams to get in. So instead of having all of these different majors, and for some who take a biology major, you may not be interested in taking courses like plant biology if you're interested in going into healthcare. So with health sciences, it is the one-all be-all major program where students have the ability to go into hundreds of different careers in the healthcare field. Some of these careers we've categorized into 6 unique pathways. These pathways include, first and foremost, patient care. The majority of our students are looking to go into a direct patient care field. This is for those of you who are pre-med, who are looking to go into dentistry, pharmacy, physical therapy, occupational therapy, athletic training. If you're looking to go into PA or nursing, if you're looking to be a respiratory therapist, any one of these direct patient fields is going to fall under patient care. But the Mayo Clinic, the hospitals all around the United States, and UMR are really trying to push that there's more than just becoming a doctor and a nurse. So the second big one that we have is research and discovery. And we're going to use COVID as an example for these 6 pathways. Certainly you have nurses and doctors and respiratory therapists on the front lines fighting COVID and the pandemic from a patient care standpoint. But there is a team at the Mayo Clinic with some PhD students who are former UMR students that are currently researching vaccinations, who are currently researching the effects of COVID on patients, both short-term effects and long-term effects. We are proud to be part of research opportunities, to offer research opportunities for our students at the undergraduate level. Mayo does as much research as any Research One university in the country, but they do not have undergraduates to help out as research assistants and lab assistants. So even as early as your freshman or sophomore year, you could be working at Mayo as a research assistant, getting paid, and doing advanced research in areas of healthcare. The third most popular is public health. And if any of you are watching the news, you will certainly see figures such as Dr. Fauci. Dr. Fauci is an epidemiologist and a public health expert. We need public health experts whenever there are outbreaks or whenever there are issues in the United States and globally that affect the population from a healthcare standpoint. These can be local issues, state issues, national issues, or global pandemics. But their jobs is to assess the risks, make recommendations on how for people to improve their lives, and give the right information to city and government officials. So we are really trying to promote more people to go into areas such as epidemiology, microbiology, virology, immunology, and really understand the world of public health. As all of us are currently in our homes, I am in my home right now. Mental health has been a big topic, not just this year, but for the past 10 years, whether it's people who are dealing with the opioid crisis and are in current recovery, to those who are just dealing with day-to-day stresses. Resilience, well-being, and mental health is a big, big national issue. It's a global issue, and we are looking for students who are also interested in going to the areas of psychology. Yes, this could also be considered a direct patient care field, but we have decided to separate mental health for those who are interested in going to clinical psychology and maybe not necessarily going into medical school for psychiatry. The last two have to deal with kind of newer areas. The business of healthcare. At the end of the day, the Mayo Clinic, and just like many other hospitals, are a business. They are here to make money. And so during this pandemic, it was decided who got to stay at the clinic, who would work from home, what elective procedures would still go on, what would not, what would be the business practices in terms of handling the pandemic. There are those who are looking at healthcare from a business aspect. Obviously, we are seeing a lot of topics such as drug prices, such as affordable healthcare and health insurance. So the business of healthcare is certainly a relevant topic these days. And of course, health technology. Right now, one of the biggest new developments in health technology is just telemedicine. Is for doctors and nurses and PAs to be able to treat patients virtually rather than in person to keep everyone safe. But health technologies could even be prosthetics and orthotics. It could be medical lab devices that go not only in the human body, but are wearable. Even something as simple as a Fitbit is a healthcare medical device that is used to help improve people's lives. So we are not a pre-med U school. We're not a school that is solely about one career. It is all the different types of careers in healthcare. We do have 4 specialized areas that we partner with the Mayo Clinic on. These include radiography, sonography, echocardiography. Those 3 specifically are deemed more imaging and medical tech. So those are your X-ray technicians, your ultrasound technicians, and they will get a certificate at the Mayo Clinic, and then usually are hired once they are graduated and certified. So we are very proud to have this opportunity for students. Respiratory care therapists are such an important part of our world today because those are the ones who are keeping us breathing and working the ventilators and respirators, especially during this pandemic. That is also a 2-year program along with the others that will get certification at the end. So for these programs, you would start UMR as a health sciences major, and after 2 years, you would do the final 2 years entirely at the Mayo Clinic, doing your clinical rotations and being certified in one of these 4 areas. This is essentially considered our second major in health professions. We do have 3 other very specialized programs. We do put respiratory care here because this is also a freshman admitting program. So not only can you come into it as a transfer student, but you can also be a respiratory care therapist as early as your freshman year. And you would start with your prerequisites right away at UMR. So you can already be accepted into the second year or the second half of the program as early as your freshman year. PA is a 3+2 partnership with the Mayo Clinic, and this is a bachelor's master's combination degree program. It is accelerated. The traditional path is 4 years of undergraduate, 2 years of PA. So this would be 3 years of undergraduate prerequisite courses. And then your fourth year, instead of doing what we call typically your capstone, you would do your first year of PA school with the Mayo Clinic. You do 2 years with Mayo, and then you've earned both a bachelor's from UMR and a master's from the Mayo Clinic in physician's assistant. Lastly, we do have a direct entry nursing program. This is essentially called a 1+3. So 1 year prerequisites, and then as long as you maintain your GPA, you're automatically into the program for years 2, 3, and 4, with your clinical rotations being done again at the Mayo Clinic. So these 3 programs, you can decide to select directly on the application when you apply. Or if you're still just looking around or want something else, you can also select health sciences as a general option. You have a first choice and a second choice option on the application. So I did mention capstone. I just want to touch real quick. What is a capstone? During your final year at UMR, all students will be asked to partake in a capstone. Now, if you're part of the health professions or one of those 3 specialized programs, your program is your capstone. But for health sciences majors that are focused on all other healthcare careers, you will do what's called a capstone in your 4th year. We encourage students to do research and internships, to be volunteers or to shadow or to do a study abroad anytime at UMR. But your capstone is essentially time that's built into your program for you to be able to do these things without having to take a full class schedule. So it's very common for many of the seniors not to be on campus during their senior year because they're off exploring their career paths by doing one of these areas in their capstones. By being part of the University of Minnesota system, you can easily take courses at the Twin Cities campus and earn a minor. We've had several students minor in areas such as nutrition, pharmacology, public health, neuroscience, among others. You could take courses at another university around the country that's part of a national student exchange program that UMR is also a part of. So during non-pandemic times, we highly encourage students to go abroad or go beyond just the Rochester borders and study away and really expand their programs through this capstone experience. So throughout this whole process and throughout your entire UMR career, you're going to be assigned a student success coach. And as I mentioned before, you're really going to get to know your coach. From academic advising to career advising to life coaching, your coach is going to be with you throughout your entire process. They are experts in their field, not only in counseling, but also in career advice from, what does it take to go to medical school? How many prerequisites do I need to take? How many letters of recommendation do I need to have? When do I need to take my MCATs? How do I study for the MCATs? So they're really going to be the person in your corner guiding you throughout this entire process. And having them really get to know you and have the time to get to know you is such a valuable part of UMR. So where do our students go after graduation? Well, many of them do go to graduate and professional schools. Here are just some of the examples of schools that we've had recent graduates get into. We don't pressure students to go right away into their professional school of choice. Some do choose to work for a little bit, earn some money to then be able to help pay for graduate school. They also work a little bit to gain some more experience. So some will work in the field, and Mayo Clinic will hire many of our students after graduation. But for those who are looking to go into graduate or professional schools, here are just some of the examples. Many of our students will stay in the upper Midwest, but others will choose to go all across the country for their graduate programs. So that's more on the academic side. We do have a student life side that is very, very vibrant. We have lots of different clubs and organizations. We have student government. We have intramural sports. Unfortunately, we do not have NCAA sports, but we do have intramural sports, and so you can play volleyball or basketball or soccer. If you are interested in NCAA sports from a fan perspective, our students are able to travel to Twin Cities to go watch Gopher games, and we do support our cousins up in the Twin Cities for Gopher athletics. But most of our students, if they're involved in certain types of organizations, they're usually cultural based, philanthropy based, We do a lot to celebrate the holidays, especially Halloween, which is our big holiday coming up. That's essentially our version of homecoming. And so we like to really make sure that our students are having fun and really enjoying the college experience. There's lots to do around the downtown Rochester area where we're located, but there's lots to do also within Southeast Minnesota. Whether it's if you enjoy the outdoors, there are lots of hiking trails and bike trails and bluffs and caves to go visit. The Twin Cities is only about an hour and a half away. So if you want to go and visit Mall of America, or if you wanted to do some other concerts or sporting events or theater, if it's not in Rochester, you can easily go up to the Twin Cities to go see some different events. We do have housing. We call it 318 Commons. This is where most of our students will live. It is required for incoming freshmen to live on campus in your first year. All of our on-campus housing are apartment style, so you can either share a room, have your own bedroom, or have your own bedroom and a bathroom. That's where the pricing will differ for housing styles. But each apartment complex will have its full kitchen. We unfortunately don't have a meal plan, so we do have a full kitchen for students to utilize. The Hy-Vee, our local grocery store, will deliver to campus along with Walmart and Target and the other Fresh Market locations. We do have washer and dryers in each unit, so there's no community bathrooms, there's no community washrooms, there's no community laundromats. Everybody gets their own apartment complex. It is a state-of-the-art facility with beautiful marble countertops and the latest in terms of kitchen equipment. So really all you'll need to bring are any countertop items as well as your bedding. Everyone is provided a desk, a bed, a dresser, closet, and of course in the living room there's couches and coffee tables. So it's a beautiful space. You'll be able to see this if you ever do decide to visit our tour. All right, so let's talk a little bit about the admissions process. The admissions process has changed this year, and so we want to make sure that everybody is up to date with the latest. First and foremost, we are a holistic review process. We do not simply admit based off of GPA or test scores. We read the entire student file. Our mission is to review students and answer two questions. One, is this the right fit for UMR? And by that, I mean, are you really interested in the health sciences? We don't offer education. We don't offer business. We don't offer, the arts. We don't offer architecture. And so if you're interested in several different career paths in lots of different areas, then we may not be the right fit for you. We're the right fit for someone who knows that they want to help someone, that their mission in life is to give back. Now, you don't have to be absolutely certain that I want to be a cardiovascular surgeon, but at least you know that healthcare and being in the health sciences is what you're really aiming for. The second is, are you academically prepared for the rigor of a STEM education? We are going to start you off with college algebra. We are going to start you off with chemistry. We're going to start you off with biology. And so we don't offer remedial courses. So we want to make sure that every student is academically prepared for UMR's curriculum. So the application has officially launched. We are both on our application, which is we call the Raptor app, and we have the Common application as well. So if you're using the Common app, we do accept the Common app. $30 application fee, though we do also accept any fee waiver that you may have. Official high school transcripts, those will be sent to us, and we will calculate both a GPA and a STEM GPA. So we pull your math and science courses and calculate both GPAs. Ideally, we'd like to see for the GPAs to be close together. They don't have to be exact, but our concern is if your overall GPA is a 3.5 and your STEM GPA is only a 2.5, well, then math and science are not really your subject areas. With this, we also will not look at weighted GPA. We only look at unweighted GPA, but we do give extra consideration for those of you who have honors, AP, IB, or any dual enrollment courses at your local community college or university. We do accept those credits. AP will accept anything 3, 4, and 5, with the exception of AP Psych, which is only a 4 or 5. IB will accept those scores as well. And for your college credits, if you have any coming in, we can't guarantee that we will accept everything, but we will accept most credits. College algebra is pretty universally accepted everywhere. But of course, like economics, well, we don't teach economics at UMR, so we will accept a course like that as an elective. Test scores. Because of the pandemic this year, UMR will be test optional. On the application, we will ask, what are your plans for testing this fall, and would you like for us to consider your scores? If you say yes, we will look at your test scores. If you say no, even if they're on your transcript, even if you've submitted them already, we will not look at your test scores. No student will be penalized for having said no for their test scores. So we want to make sure that students feel not pressured to get an ACT, SAT this year when it's simply not possible. Now that's for fall 2021. We're currently evaluating for the future and hope to make an announcement soon about the future of UMR and ACT and SAT testing. Letters of recommendation are optional, and our priority deadline for scholarship consideration is December 1. So you have about 2 months as of today, October 1. But we also have December 1 as our deadline if you are applying for the nursing, PA, or respiratory programs. Those 3 programs will review in late December, and each program does have an interview process, which will happen in January. Those are limited seats for all 3 of those programs. The health sciences program, there is no minimum GPA, there is no minimum test score, there is no minimum requirements, but we are looking at students who are strong in the math and sciences and have a passion for healthcare. Other areas that we're looking into, if you've done any extracurricular activities such as shadowing, volunteering, and done anything in a hospital setting, we want to hear about it. We want to hear about your passion for healthcare. That short answer question on the application is also your scholarship question. So that will be looked at for scholarship consideration. So please tell us everything that you've ever done or thought about when it comes to health sciences and healthcare. Even if it's, I've been thinking about becoming a doctor or nurse ever since I was 3, we want to hear about all of those stories. If you've done other extracurricular activities such as sports, such as the arts, anything, we want to hear about it. We want to see how well-rounded you are as a student. We want to hear about any leadership opportunities that you have. There are plenty of ways to showcase this on the application, so feel free to tell us everything that you've been able to do in high school. There is also a special circumstances section. If COVID-19 has affected you in any way, shape, or form, or if you've had any other hardships or burdens during your 4 years of high school, please let us know. We are absolutely understanding about what has been happening to our students who've had to struggle by being at home. We also know about the struggle for students who've had psychological, physical, mental, and emotional issues throughout high school. This does not mean that you are a bad student. It just means that you've had a hurdle, that you've overcome this hurdle, and that you are still a great student to become a great healthcare provider. So we want to hear about these stories so we can better understand it. Otherwise, all we see on the transcript are letters, and all we see on your test scores are numbers. For financial aid, we use the same code as the Twin Cities. So please feel free to get your FAFSAs in as soon as possible. There is so much federal aid available. All you need to do is apply, and it is a free application. Like I mentioned, we do have scholarships. We have scholarships that range from $1,000 to $8,000 a year. We also encourage students to look at private scholarships in their local community, in their state, and also nationally. Also, one thing to note about UMR is that we do not offer out-of-state tuition. So all students will pay the exact same tuition rate as an in-state Minnesota student. Tuition is roughly about $13,000 a year. If you were to add housing, you're looking at about $23,000 a year. And then with books and fees and all of that, you could be at usually about $25,000 a year. So that's the in-state rate, and that is the exact same rate that you will have. Typically, out-of-state students sometimes have to pay $10,000, $15,000, $20,000 more, but we're trying to make this as affordable as possible. So we've already cut that rate to the in-state rate for UMR. So with that, I'm just going to finish up with a couple of points, and then we can open it up to questions. First and foremost, for campus visits. Currently, UMR is offering both in-person and virtual campus visits. For in-person visits, we have the ability to do individual tours, so basically private tours. Those are filling up fast, but we will be offering those throughout the year. And so you can certainly come to Minnesota if you're interested. Otherwise, we encourage you to check out our virtual tours. We have 3 virtual open houses coming up, one focusing on those 3 specialized programs, one on financial aid and scholarships, and the other one on housing and residential life. We are also able to chat with you virtually as well and do a virtual campus tour, which will consist of myself giving a very similar presentation, as well as an ambassador who will do a walking tour, a virtual walking tour of campus. So we are available to meet with you. I will be your personal admissions counselor for now until the time you arrive at UMR. So feel free to email me or email the general UMR email, and we can absolutely help you out in any way, shape, or form. We're here, like I said, to guide you from now until day one that you start at the university. So with that, that really concludes the UMR portion of the presentation. For those of you who are chatting, you're able to type in some questions if you have specific questions about UMR, and I can try to answer those now generally for the next 15 minutes. But otherwise, thank you all so much for taking the time to watch this video, and I hope to see your application soon. Good luck with everything, and again, a quick hello to all my former friends from the Cleveland, Ohio area. So thanks so much. I will stop sharing my screen and wait for any questions.
Okay, that was wonderful, Brett. I see that there aren't any questions that are typed into our screen at the bottom. I do want to put up some information for our students and those that will watch this at a later time, that anything that has been shared will be recorded and kept on the OACAC website. So you can go to oacac.org. When the webinar does end, don't worry, you will be able to get in touch with Brett at another time to ask questions about his health sciences and health professional programs. But there's a quick 4-question survey that's at the end. We appreciate your time this evening. And Brett, thank you up for giving us such great information. I hope you have a great evening. And as we head toward the weekend, have a good weekend as well. Thank you very much.
Thank you so much.